How do I feel when I fall? Totally helpless. Balance issues for myself are a major contention. There's something I have to pay attention to all the time. Having to be concerned about balance is really something I never thought I'd ever have to do. It feels like I've been robbed.
Falls are very common in people with Parkinson's disease. Probably at least half of people with Parkinson's disease at any one time, if you ask them if you had a fall, they'll say yes.
Falls are one of the highest predictors of future falls, and when patients fall, if they fall often, it affects their confidence. There's a fear of falling, a fear of injury. That inhibits their movement more and actually places them at greater risk for future falls.
The centers of the brain that both sense when you're going to fall don't work quite as well, so you probably don't know you're falling as soon as you would otherwise. And also the ability to get the muscles to initiate a movement to stop yourself from falling are affected as well. Most people benefit from seeing physical therapy. There's been a lot of research on exercise and the use of exercise in preventing falls and also in slowing down the disease in general. So I send my patients to physical therapy before we've even thought they might have a fall.
Oh, exercising and stretching have been a godsend for me. I'm able to utilize exercises and stretches to help stabilize my body so that balance is not such a problem.
Numerous studies over the years have shown that exercise is highly effective in keeping patients safe and strong and ability to interact with their environment.
Stretching and exercises are everyday routine for me anymore. I go to a physical therapist once a week, dealing with balance and coordination issues.
I use a variety of exercises with my patients. We try and keep things functional. On your feet. Asparagus. Asparagus. Back down. Patients need the ability to be able to stand from a chair. They need to have that strength, and after changing positions, oftentimes that can throw a patient's balance off. So we work on sit to stand, stepping and walking drills. Oftentimes I'll have patients walk and step over obstacles along the way. Stepping frontwards and backwards and sideways are all very functional exercises that they can do. We also tend to do a little bit of work on strengthening.
People with Parkinson's are really able to make tremendous strides if they're willing and able and motivated to stick with an exercise program.
Starting an exercise program before a patient ever falls, starting an exercise program before a patient becomes too disabled is vital. It's easier to keep abilities that you have than to get them back after they're lost.
And as I've been doing the exercises and stretches that I'm involved in, I feel better. I feel more like I'm in control of my body.
The whole purpose of home care in the initial stages is to be proactive about falls. We want to make sure that people are safe in their own homes.
Interacting with professionals such as occupational therapists and physical therapists, especially an occupational therapist, was very helpful for me.
Meeting Henry and his wife, right off the bat, you could see that they were going to be open to a lot of ideas and suggestions. As soon as I walked in the door, they had the expression on their faces that, okay, we want to learn. And Henry was able to immediately start pointing out areas where he had difficulty. He seemed to know what occupational therapy was all about.
How many steps are going into the house? How to accommodate those steps without feeling like I'm going to fall? What does my bathroom look like?
There are some options for you. One of them is maybe putting in a bench that's as wide as your tub.
Are there any throw carpets down in the house that maybe could be removed to eliminate a trip hazard?
Things like rugs that had a little bit too abrupt edge, bathtub that's a little too deep for him to get in and out of, a toilet that's a little too low for him to get in and off of comfortably and safely. All of those things were things that he was already aware of or had in the back of his mind. And I think what I did more than anything was just kind of like put them up in the front of his mind.
Simple things like push the chair into the table so you don't have to walk around it. Those are not things I ever had to worry about before. But for a professional to bring them to my attention, and then I go home and I look at what's going on, yeah, that discussion is very helpful in my life.
When you come into the home and you say, oh, you've had a lot of falls, but these are some solutions that we can present for you, and we can maybe stop all that cycle of falling and keep you at home. And that's hopeful for people. They just want to stay at home. And we can actually help them with that just by changing a few things in the home, making some environmental modifications, and maybe adding some equipment. I had a patient one time that told me that she thought that the difference between occupational therapy and physical therapy was that her physical therapist taught her how to move and how to be strong, and her occupational therapist taught her how to live.
Many studies have shown that the team approach is more effective. Many hands make light work, and many brains come up with good ideas. And I think the VA does an exceptional job of having a team structure.
The fact that Henry is able to do things like go down to a squat and then come back up, clearly he's been working on that. Clearly he's been exercising. All those things that he does for himself are going to really impact his whole life and in such a positive way.
Henry has shown an exceptional ability to be aggressive, to combat the disease and go after it, and to stay on his routine and to take his medications and to do his exercise and to ask for help when he needs it. He has been a star pupil.
A key issue here for physicians, physical therapists, occupational therapists, is looking at their patients that have the Parkinson's and doing everything you can to encourage them to work on their balance, because that's the mainstay. If you can stand straight, if you can hold yourself, it gives you part of your life back.